Good evening, everyone. Thank you for joining us to attend the talk, Forget Six Packs, Are You Liver Fit? The engine, the factory, the detox mantra within us, by none other than the renowned Dr. Arvinder Soin. Soin maintains an action-packed schedule, packed with not just surgical procedures, but also with research, innovation, teaching, examining, conferences, workshops, and much more. So we are very glad that he's taken up time to deliver this talk. Then again, this is also something he's adept at, as he has delivered a whopping 1200 talks around the world. So now, I welcome you to talk 1201. Now, before I request my colleague Yashna to tell us about Dr. Soin's illustrious profile, I'd like to request everyone to kindly put their phones on silent. Thank you.
Good evening, everyone. Our speaker, Dr. Arvinder Soin, has a very long, illustrious career. I will try to encapsulate it in brief. Padma Dr. Soin is Group Chairman and Chief Liver Transplant Surgeon at Medanta Institute of Liver Transplantation and Regenerative Medicine, Gurgaon and Lucknow, India's largest and most successful liver transplant center. He is also Chairman, Liver Transplantation at Sir H.N. Reliance Foundation Hospital, Mumbai. Dr. Soin holds degrees in MBBS and MS from AIIMS, that is the All India Institute of Medical Sciences, New Delhi, and FRCS from Glasgow and Edinburgh, as well as FRCS Intercollegiate Subspecialty Transplant Surgery. Having performed the first successful liver transplant in India, both adult and pediatric, way back in 1998, he has performed the highest number, over 3,000 of successful liver transplants in India. He is a surgical innovator, researcher, and healthcare investor. With many firsts in terms of innovative complex surgical techniques, he is justifiably renowned in India and globally for his pioneering contribution to liver transplantation and has placed India on the global liver transplant map. He has shared his valuable work through numerous articles of his original research and has delivered 16 orations and over 1,200 lectures globally. Over 120 liver transplant fellows, as well as visiting transplant doctors and paramedics trained by Dr. Soin, are running more than 100 centers all over India. He has supervised over 100 clinical research projects and has been prolific in research, teaching, examining, conferences, workshops, and consensus groups. He holds this important position in professional organizations, both national and international, and was recently inducted as Executive Council member of International Liver Transplant Society. He has been felicitated with many awards, both national and international, and has been conferred the honorary fellowship by KGMC Lucknow. Dr. Arvinder Soin is particularly admired as one of the country's foremost healthcare influencers and acknowledged sensible voices during the pandemic, as can be seen that he is one of the most followed physicians on Twitter globally, with nearly 100,000 followers. This is but a very brief profile of Dr. Soin's sterling career. Please check out his website to get more details. I would now request the moderator, Anu Jindal, to please tell us a little about the Fitness Forever series of talks. Thank you.
For giving us this opportunity to have this series of talks, which is titled Fitness Forever. This is the very first talk. And the inspiration for this series of talks is good old COVID. One may wonder why I'm an artist, I'm a curator, art historian, and why am I dealing with this subject? But COVID has forced us, the inimical COVID, which is in a way our bosom pal, because it likes to reside in our chest and then spread its tentacles all over our body. And how a minuscule germ that can be annihilated by the simple soap has brought all of humanity to our knees, or many of us to our graves. How helpless we feel, flapping around, confused, defeated. कैसे एक छोटे से कीटाणु ने हम सबको इतना हताश कर दिया. While not much can be said or done in the face of the fury of nature, what is in our hands is the least we can do is to take care of ourselves. Our body is a gift of nature, as the Buddhists say, precious human life. Rather than fall prey to diseases, how can we build up the strength, the immunity to shun diseases and follow the maxim, prevention is better than cure? The Fitness Forever series will encompass how to take care of body and mind, and will have a variety of speakers to guide us through how to take care of our nutrition, exercise, and how to be stress-free, how to be happy, how to laugh, how to learn to enjoy this precious human life. We are very grateful to IIC's director, Mr. K.N. Srivastava, for having given the go-ahead for these talks. And we are very lucky to have with us Dr. Arvinder Soin, one of India's most accomplished doctors, who has a massive following both in India and globally. I now request Dr. Soin to kindly deliver his talk. Thank you.
Thank you, your team and esteemed guests, for being here today and for inviting me to do this talk, which is obviously about liver, but close to my heart. The thing is that many thousands of years ago, and up until recently, the seat of emotions was variously thought to be the heart or the liver. It was very confusing. The science has now managed to tell the difference and tell us what the liver actually does, but you're all familiar with these terms. Jigar ka tukda, jigari dost, jigar rakh, associated with kind-heartedness, friendliness, courage. So obviously this organ, which is the largest organ in the human body, which sits in our upper part of the abdomen, it's been thought to be the seat of emotions and emotional happiness. So a healthy liver has been, since time immemorial, equated with being the pinnacle of emotional well-being. And that's from the times when they didn't understand liver function scientifically, and obviously felt that if one's liver were healthy, one would be happy and healthy in general. So let's see why the liver has been put on such a pedestal. So what basically happens is, you take in stuff, whether it's food or chemicals, which are, let's say, raw materials, through intestines, through blood, that means when you get injected some drugs and chemicals, and through your breath. So those are the three routes through which these raw materials enter the body. And then they are dealt with by the liver in 70% of the total volume of what we get in. 30% directly goes to the various organs and gets absorbed or gets used, but 70% is processed by the liver. What the liver does, it basically secretes bile, which digests fats. It makes glycogen out of all the carbs that you take, and that is converted to glucose. Glucose is the actual body fuel, right? That's the fuel that the entire body uses, be it muscles, joints, bones, or other organs. And that is stored in the liver as glycogen. And it is convertible between glucose and glycogen whenever the need arises. It processes and converts all these food types, that's carbs, proteins, and fats, and any chemicals, to usable forms. So these are raw materials, then they are processed, manufactured in the factory, that is the liver, for use elsewhere in the body. Liver also manufactures a lot of proteins, and proteins, as you know, are basic building blocks in our body. It manufactures hormones. Now, hormones are substances, they are largely protein substances, and some of them have steroid structures, which control everything in the body. All kinds of functions are controlled with hormones, be it sugar levels and diabetes, be it sexual function, be it bone health, anything, be it, whether your metabolic rate is fast or slow, that's thyroid hormones. So all kinds of functions in the body are basically controlled by hormones, and most of the hormones are manufactured, or the final steps of their production, whereby they can actually have their desired effect, happens in the liver. Then it manufactures carriers. Carriers means these carriers are substances, they are generally protein carriers. And these carry various substances from the liver through the blood or via the blood into the other organ systems. And then it serves the function of detoxification. So it detoxifies alcohol, drugs, medicines, viruses, bacteria, anything that goes into the body. That's where all the detox happens. And of course, then finally, like in any factory or manufacturing unit, not everything can be used straight away, so it stores nutrients. And then, after it has processed, chiseled, manufactured, modified everything that the body takes in through the 3 routes that I talked about, it excretes some of the waste via the bile, which goes back into the intestine and out through the feces or the fecal route. And the rest of this useful stuff is poured into the blood. And then the usable substances will go to various organs, muscles, bones, and help the body to function and live. And the ones that are waste materials will actually get excreted through the kidneys. So that's what happens. And that's how liver is central to processing and manufacturing and storing everything. It's the center that directs all substances to go to their destinations in the body. And therefore, these are the various portfolios the liver has been accorded: the processor, the factory, the engine, the storehouse, the detox system. Now, let's look at each of these functions. Of course, there are 500 plus functions of the liver. I'm not going to take you through all of those. That's going to be, besides time not permitting, it's going to be boring. So I'm just going to take you some of the ones that you could identify with easily. So let's look at food and metabolism. So I've already said that liver produces bile that digests fat and carries away the waste. It also regulates the blood levels of amino acids, which are the building blocks of proteins and muscle. Then it converts and stores carbs and glucose as glycogen. And in times of need, when there isn't enough carbs, it even converts the proteins and fats into glycogen. And then this is convertible back into glucose, and that's used as body fuel. So it is really central to all what the food that we eat does to our body. Now, immunity and protection. The liver has roughly about 40 to 50% of the immune function of the entire body. The rest of the immune organs are the spleen and the lymph nodes, and minor functions happen in lots of other organs. But you can safely say that liver is a major player in immunity. And that, with that function, it resists infections and cancers by making immune factors that neutralize these cancers and infections, or infectious organisms like viruses and bacteria. The liver removes toxic wastes and bacteria and viruses and fungi. It clears bilirubin. Now, bilirubin is a natural pigment which comes out of degradation of hemoglobin. And it's like a waste, basically. And that's what gives the feces its color. So that's excreted via bile into the intestine and out through the fecal route. Now, detoxification happens to drugs, to medicines, to alcohol, and ammonia. Now, what happens is that when protein gets used in the body, especially in muscle building and growth, there is production of ammonia. And that is converted to urea, and that's then put into the blood and is excreted out through the urine. So when the liver doesn't work, excess levels of ammonia will accumulate. It also detoxifies any environmental toxins, wherever they get in from, the oral route or the breath, pollutants, allergens, I already said viruses, bacteria, and carcinogens, or the cancer-generating substances, fatty acids, and steroid hormones, because there is often excess of steroid hormones, which need detoxification and the waste to be expelled out. So, if you tax your liver, this is what's going to happen. If it's like a sewage plant and you overwhelm it, then of course it won't be able to detoxify enough, and then the bad effects of all the toxic substances which have not been detoxed will be affecting the rest of your body. Now, blood clotting is another very important function. So if you look at the first cartoon, this is a blood vessel. Blood vessels are simple cylindrical tubes, and the red cells, or the RBCs, are the ones that basically give the color to the blood, right? And when there is a breach in the blood vessel, that's in an injury, then there is bleeding, and then this bleeding will not stop unless there are clotting factors which are operating in balance in the body, and the clotting factors come from the liver. So on one hand, it would stop the bleeding. The so-called clot that forms after a minute or two after you get hurt is this clotting factor driven clot. And the other, of course, the other thing that causes clotting is platelets. The platelets are already present in the blood, and along with clotting factors, the clot tends to seal the bleeding vessel, like here. But on the counter side, there is a downside to clotting, and that's if excessive clotting happens within the blood vessel, there will be what we call thrombosis. It could happen in the heart vessels, in the brain vessels, and that could cause a blockage of the blood supply and stroke. It could be a heart attack or a stroke. So there has to be a fine balance maintained between the various types of clotting factors and platelets. And what does that? The liver does that. So when the liver is diseased, what you're going to have is excessive bleeding, and in certain circumstances, even excessive clotting. So you have to add another portfolio. It's really the protector of the body, because apart from detoxification, it prevents you from having thrombosis or excessive bleeding. So you have so the liver actually wears all these hats. Now, what else makes the liver unique? Reserve. Most of you have heard that liver has extensive reserve. So if the liver is normal, just about 25% of it is needed to sustain life, or to have normal liver function, so to speak, in a person. So just 25% of it. A lot of patients come to me with liver disease, and I tell them that 70% of the liver is damaged. And they would say, "Doc, that's fine. I still got 30% of normal liver," but that liver is not normal. It's already diseased, it's already inflamed, it's already affected by the injurious agents, whether it is hepatitis B or C or alcohol or excessive fat due to diabetes, etc. So a person who has liver disease may have 70-80% liver damage, but even the remaining 20 or 30% is not absolutely healthy. So the story about reserve doesn't work there. The second unique characteristic of the liver is regeneration. Just like we are used to seeing growth of hair, nails, just as a routine phenomenon, you don't even think about it. Well, actually, liver is one internal organ that grows back. So if you remove 70-80% of it via an operation or in some injury, the rest of it will be restored within 2 months. There is this very interesting mythological story in Greek mythology where Prometheus, I don't know if you've heard of this, Prometheus was the god of fire among all the Greek deities, among the Titans. And the chief god was Zeus. So Zeus was not very keen to create humanity, whereas Prometheus actually created humanity, and then decided they needed fire and they needed some skills with metalwork. So he gave humans, or man generically, fire by stealing it from Zeus and passing it on to the earthlings. And Zeus was very cross. So he actually chained the human form of Prometheus to a rock, and then had a vulture come in every day, and the vulture would eat most of his liver, but next day the liver would grow back. So the vulture kept doing this. So this is like a mythological example of the appreciation or the realization that liver is one organ that grows back. And that is what we use in transplantation, specifically living donor liver transplantation, whereby someone who has a diseased liver or liver cancer restricted to the liver and needs a transplant can actually take half a liver from one of their loved ones or one of their family members, and we transplant that half a liver into the patient, leaving the other half for the donor. And both the halves, the half that's left in the donor and the new one that goes to the patient, will grow back to a normal liver size for that person within 2 months. This happens literally every day in my work routine, and that's how living donor liver transplantation has become so successful in India, because we don't get enough donors of the other variety, which is cadaveric transplantation, whereby people who are dying of brain death, their families can donate their organs. That doesn't happen very often. So we resort to living donor liver transplantation using this quality of the liver, the regeneration. So 75% is removed, and it will grow back. The remaining piece grows back. Sexual function. Now the liver regulates the balance of sex hormones. So in liver disease, in children, if they have liver disease, they would be not developing their sexual characteristics fully. So not just be growth retarded, because the liver affects bone growth as well, but also secondary sexual characteristics do not develop fully in these patients. So typically when we transplant kids, their parents and the kids themselves notice a very appreciable change in this pattern after transplantation. In adults, in males, of course in all adults, the balance of the hormones or sex hormones is disturbed. So in males what happens is that there is excessive estrogen, and because of the excessive estrogen there is loss of muscle, there is breast enlargement, male breast enlargement or gynecomastia, and loss of libido. In women, again, they could be severe PMT type symptoms or loss of libido. So sexual function is very closely related to good liver function. And again, this is something that our patients tell us after transplantation, that their sex life has improved remarkably or actually gone back to normal. Sleep. Now, what happens with sleep deprivation? I mean, you're supposed to get 7 to 8 hours of sleep every day, and that's an absolute must. Everybody in the world agrees on that. All systems of medicine agree. And what sleep deprivation does is that it causes fatigue, and obviously the person exercises less. There is a fine balance between leptin and gliadin. So these are hormones that, these are chemical substances that define your satiety. So with less leptin, there is less satiety. So the person feels like eating more, and they can't control their binge eating. So if somebody is underslept, or it's happened to you, sometimes it's definitely happened to me, if I have underslept, I tend to eat more. And then you will obviously have weight gain, fatty liver, hormonal imbalance, and the whole lot. And also when the liver is diseased, there is an effect of the toxic substances which are not cleansed by the liver, and they get to your brain, and that gives excessive drowsiness. There could be a change in sleep pattern, like the patient might actually sleep more during the day and be absolutely wide awake during the night. And I know it happens to some of us in normal life, but it is especially a symptom of liver disease. I saw this interesting thing put up in my son's college dorm, Sleep more than you study, study more than you party, and party as much as you possibly can. Emotions. Now, stress, as we know, releases adrenaline and a host of other chemical neurotransmitters that in excess will cause emotional lability. So liver tends to cleanse the excess of these substances, and in liver disease they will accumulate, and obviously your emotions will run absolutely haywire. So that's the other again, the other symptom we quite often find in patients who have liver disease, that typically the wives will complain that he's become so angry since he's got this liver disease, and it never used to be like this. So it's all got a proper biological and chemical basis. Now, what about liver and muscle building? Amino acids, especially branched chain amino acids, the ones that are there in the protein shakes that every young person has before and after their gym. These are the building blocks of muscles. But who or what decides as to how much muscle will be built and how much will be degraded? It's the liver. So that's what maintains the balance. And in liver disease, one will have, I already said, one will have increased ammonia. One will also have an increased level of a substance called myostatin, and that actually retards muscle growth. And one would have a reduced level of growth hormone, and all these changes will result in muscle wasting. So again, liver health and muscle growth are closely intertwined. Now, let's talk about fatty liver, because 1 in 3 of us actually have fatty liver, maybe even more, whether or not we take alcohol. So this is also called, in medical terms, steatosis or hepatic steatosis. And this is because of excessive accumulation of fat in the liver, usually more than 5% of the weight of the liver. And it could be alcoholic or non-alcoholic. So if one doesn't take alcohol and still suffers from fatty liver, that's a thing. And that could happen to, like I said, 30-35% of the adults. So a healthy liver looks like this under the microscope, and an unhealthy liver goes a bit yellow to the naked eye and has all these fat globules, the white ones, under the microscope. Now, fatty liver has several stages, because people ask me, Doc, if I have a fatty liver, am I going to get liver failure or liver cancer? The answer is there is a small chance that you might. So the various stages of fatty liver are simple fatty liver, where there is excess of fat in the liver, and this is called NAFLD, non-alcoholic fatty liver disease. Like I said, a third of us are afflicted with this already. Then there is steatohepatitis, which means there is fat along with inflammation, and this is NASH, non-alcoholic steatohepatitis. And then there is fibrosis. Along with the inflammation, there is some scarring. So fibrosis is a medical name given to scars. So when one gets hurt anywhere, and the hurt is deep enough, you'll get a scar. And that scar tissue always remains, it never goes away. It never becomes normal skin. So similarly, if there's scar tissue in the liver, that's not really reversible. It's going to be permanent damage. And then is the final stage, cirrhosis, which is a term given to liver damage when more than 50% of the liver volume is replaced with scars. So these are the various stages, and like I said, the fibrosis stage and the cirrhosis stage is largely irreversible, although early fibrosis may be reversible. What are the causes of fatty liver apart from alcohol? Being overweight, having uncontrolled diabetes, even controlled diabetes, eventually after 10 years can give fatty liver. Insulin resistance is a state of existence where there could be diabetes, or some individuals may be insulin resistant and not even have diabetes. but it does cause fatty liver. Dyslipidemia, which means basically bad lipid levels. So high cholesterol overall, high LDL, low HDL, high triglycerides. So if you have dyslipidemia, then that's a predisposing factor to fatty liver. And then of course a sedentary lifestyle on its own, which means lack of exercise, even if you're not overweight. Just having a sedentary lifestyle itself is a risk factor for fatty liver. So overeating, overdrinking, and being overweight, bad news. Now, a word about liver and alcohol, because everybody keeps asking me how much alcohol can I have, doc, without knocking my liver off. So basically, there are different figures from different societies and the WHO. If somebody has more than 14 units per week, if a man has more than 14 units per week, or a woman has more than 10 units per week, for 8 years at a go, they could easily develop liver cirrhosis and or cancer. It's not necessary they will, but they can. And what determines that? There is this individual capacity to metabolize alcohol, which could be related to the genetic makeup or even ethnicity, and the kind of diet that people take. So now what's 1 unit of alcohol? It's about 10 mils or 8 grams of pure alcohol. And I don't want to go into how much alcohol everything has, but beer is like 5%, wine is like 12 to 15%, and whiskey is like 30 to 40%. So you can calculate your alcohol intake accordingly. But what happens is that alcohol causes fatty liver to start with. So this is normal liver, and this is steatosis or fatty liver. And then this could go into the inflammatory stage, hepatitis, and eventually cirrhosis. And any liver disease can cause cirrhosis, chronic liver disease that is, largely the non-alcoholic fatty liver disease type, alcohol, hepatitis B, hepatitis C. And when one has liver disease, even when one hasn't progressed to the stage of cirrhosis, one can develop liver cancer. So liver cancer is one of the cancers in the body, which 99% of the time only affects livers that are diseased. So there will be a disease pre-existing, and then a cancer will develop. Now, the question is how to keep your liver healthy, and what's a good diet for the liver? Well, green leafy vegetables, citrus fruits, garlic, ginger, olive oil, all kinds of berries, beet, the root vegetables, eggs, fish, nuts, coffee. These are good. And what's bad is excessive alcohol, refined sugar, trans fat, that means all the baked stuff, the pastries and cakes and all, and fried food, and processed foods, and red meats. So please be mindful of what you take, because it's going to go into your liver and mess your liver up and then mess your body. So this is a cartoon I borrowed from the Harvard nutritional website from the School of Public Health, and this basically gives you the proportions of things that should be in your plate: vegetables, fruits, healthy protein, and whole grains, and just specifies the amount of liquids and coffee and everything. This is an interesting one I came across. So what you eat matters. So you say, okay, I'm going to have a small amount of the forbidden stuff, fried food, etc., and I'm going to make my calories good with that. But it's going to be very difficult to resist taking excess of that. Why is that so? Because of the concept of the calorie density. So calorie density means that if you actually take oil, it gives you the same 500 calories and occupies only this much space in the stomach. If you take cheese, it occupies about a fifth of the stomach. If you take meat, it occupies half. If you take potatoes, rice and beans, it occupies about 75%. And if you take fruits and vegetables, it occupies the entire stomach by the time you get 500 calories in. So that's the logic of why you should have ample servings of fruits and vegetables in your diet, because that's going to prevent you from overeating and doing excess calories. Now, how is exercise related to the health of the liver? Well, the liver metabolism works best with regular exercise. Otherwise, fat accumulates, muscles will slowly atrophy, and there will be hormonal imbalance, and I've already told you what all that does. You heard of FIT? It's a prescription for exercise. F stands for frequency, I stands for intensity, T for time, and T for type. And all the types of exercise are important, be it endurance, strength, balance, flexibility, cardio, resistance. All exercises are important in balance, right? So what's a typically sound, fit prescription like? It should be moderate intensity exercise, at least 5 days of the week, with a total of around 150 minutes plus per week, right? And there should be a mixture of various types of exercise. I tell you a simple concept to remember for whether the exercise is mild, moderate, or severe in intensity. It's the Singh, speak, neither concept. So if you're doing mild exercise, you should be able to sing. If you're doing moderate exercise, you should be able to speak. And if you're doing severe intensity exercise, you can do neither. So that's the parameter, that's the way you measure what kind of exercise you're doing, and it will be different for different people. What would be severe for me may be mild or moderate for you. So I think I'll just sum up now saying that to keep your liver healthy, you have to control or avoid obesity, diabetes, bad lipids. You obviously have to have a balanced diet. You have to get exercise, you have to get good sleep, you have to avoid excess alcohol. And a little word about hepatitis B vaccination, because everybody, there is this need for universal hepatitis B vaccination, and that prevents hepatitis B infection. About 30 years ago, the commonest cause of liver failure used to be hepatitis B, but that's no longer true in most parts of the world, because right from when you're born, you get hepatitis B vaccination. So that prevents hepatitis B. So we must all change, because if you continue to do what you've always done, you will continue to be how you always have been. So it's not too late, and I'll end with putting up another one I picked up at the Son's college dorm. You can't go back and change the beginning, but you can start where you are and change the ending. Thank you very much. Happy to take questions, discuss a drive for universal hepatitis B vaccination all across the world in all countries. You had the standard schedule is 016, which means you take for yourself, for example, you would take a dose now, and then after a month, then after 6 months. And then you test what's called anti-HBs levels. Those are antibodies that your body will produce as an indicator of the fact that you're immune to hepatitis B. And in some immune suppressed people, and generally some other people who may not develop enough immunity, they can do a 4th or a 5th dose. It's harmless, it's recommended
For everyone.
for everyone.
Because I don't think even my children ever got it.
Everyone must
They
have it.
would have got it when they were young.
Everyone must have it. You talk to your children's pediatrician, they will tell you
The pediatrician
otherwise.
will be having a book. It's always given.
There is a
How long
immunization
has
book,
it
right?
started? About 10 years ago?
This
25
universal
years
vaccination
ago.
thing started
97.
even longer. There's intense research going on in so many of the top laboratories of the world to figure out what substances are responsible for liver regeneration as opposed to it not happening in other organs of the body. But Of course, we know of many factors. There are several protein molecules which trigger regeneration. Whenever injury happens, there is an upregulation of those molecules, and they will induce cell division and cell hypertrophy. That's why the regeneration happens. And in a sense, those cells and those substances or protein molecules which are there in the bone marrow also are found in the liver. Now, as you know, bone marrow, there is absolute regeneration of all kinds of cells, right? So the bone marrow renews every few days. And similarly, those very similar protein molecules and triggers are found in the liver as well. This is something that's naturally made like this. So we know that the liver regenerates, we know some factors that are responsible for it, but not everything is known at the moment. What happens is the majority of the people, they may have vegetables, but they have it with a lot of oil and not the right kinds of oil. That's one reason that they can have fatty liver. A lot of us have a lot of samosas, puris, you may not have them, but normal mortals have them. And, it's all vegetarian stuff. But some of the most calorific stuff that I know is vegetarian. We've all grown up on chola kulchas and we all still love them. And with a single plate of chola kulcha, you'd be having 1,000+ calories with the way the chanas are made and the kulchas are made. So, it's not true that only non-vegetarian people will have excess calories. You can have excess calories even as a vegetarian person. The other is that, like I said, people have a genetic tendency, and it's not like your forefathers and father are over, having a fatty liver, but it's because of a genetic makeup that you have that tends to process fats differently. So that's possible, right? The third thing that I told you, diabetes, being overweight. What's your height and weight?
I'm 80 plus and I'm 5 feet 10 inches.
5 feet 10 inches.
170 centimeters.
70 and 80.
170 centimeters and 80 to 83.
Right, 80 to 83.
So I have a very high, I have excess weight, I am obese basically.
So that's your answer.
Is hepatitis C is also a big contributor to for liver cirrhosis? Because hepatitis, as far as I remember, the hepatitis C virus can also be transmitted through contaminated water, and it's one of the being in India is one of the biggest contributor for hepatitis.
So C for China does not get transmitted through water. So C for China, hepatitis C, hepatitis B, they both get transmitted exactly in the same way as AIDS. Which means through blood and body fluids.
Right.
They get transmitted through IV drug pushing, through sexual contact with multiple partners, through dialysis machines, through infected blood, just the same way as AIDS. Right? So prevention of hepatitis C has to do with prevention of all those practices that cause this. So, disposable needles, dialysis machines being checked and being separate for hepatitis C patients, all the blood being checked in the blood banks, etc. Those things are standard for hepatitis B and C and AIDS. Hepatitis E is the one that is very common in India, actually E for England, and A. A and E get transmitted through water, and they cause just a short illness of around 2 to 4 weeks, and they are the common jaundice that some of us or a lot of us have had when we were younger. And they get okay in 2-3 weeks, and they are not chronic diseases. They don't destroy the liver.
So they do not contribute towards cirrhosis or anything like.
So A and E do not contribute towards cirrhosis.
Right.
C contributes towards cirrhosis, but now with the universal prevention drive and very effective medicines for hepatitis C, the number of cases with cirrhosis who have hepatitis C as the cause have reduced over the last 10 years. But yes, it is one of the causes.
Yeah, I think that is hard, that highly active antiretroviral therapies which are used for hepatitis C treatment.
No. So again, you're confusing. Heart is for AIDS.
Okay.
they are caught and spread in the same way, but treatment is different. AIDS is a retrovirus and the treatment is hard. Hepatitis C has different treatments. They are basically, if you want to know, then no, interferon is old now. Now it is sofosbuvir and velpitasvir. They're kind of tongue twisters. So sofos, buvir, velpitasvir. So those are the two best medicines available for hepatitis C, and that they have got a 99% cure rate.
Wow.
So there is no vaccination for hepatitis C?
None for hepatitis C, but only for B. If the obesity comes down, if you become more near your ideal weight, the fat in the liver will reduce. If your diabetes is well controlled to a HbA1c of around 6 or less, then yes, the fat in the liver will reduce. There are also medicines that can reduce the fat in the liver. One is very common, vitamin E or Evian. So Evian has been in doses of 400 twice a day for 3 months plus, has been shown to reduce some quantities of fat in the liver. You could go from grade 2 to 1. And there are some newer medicines which dissolve the fat in the liver, but no point discussing them here. But yes, largely 70-80% of the job is done if your weight and diabetes come into consideration.
As a part of trying to lose weight, I was advised to go low on carbs, and they said that you can increase the fats. But when I heard the fats are not good in the sense we should control the intake of fats. But the advice given was that you go low on carbs and take more of fats that will help you lose weight faster.
So the type of fat is important. So the trans fats, which means the ones that you get with cakes and fried food, those are not good. But the ones which you get with nuts and fish, they are good, mono and polyunsaturated fats. So, and also you get a lot of essential fatty acids with fish and with nuts. So those are good for you, and those are important for muscle building in your body, and they will actually tilt the balance of the glucose coming down. So that is correct.
Thank you.
It's a little more complex than what I made out to be. I mean, like I said, I tried to make it simple. Yeah.
How do you check for fatty liver?
How do you
Check for fatty liver?
check for fatty liver? That's a good question. So, if you're a person who's fit, who's got an ideal weight for their height, and if you're under 40 and you have no risk factors and no family history, then you're okay not testing. But over 40, and if you have any of the risk factors like being overweight or having diabetes or bad lipids, etc., then you should do liver function tests and ultrasound of the abdomen. And in the ultrasound, grade 1, grade 2 fatty liver can be detected. And then the liver test may or may not be affected. If the liver is just mildly fatty, grade 1 fatty, the liver test may not be affected. But if the fat is more than mild, or if there is inflammation in the liver, like the state of hepatitis, then the liver test may be affected. Once there is fat in the liver on ultrasound, then a fibroscan is a good test to see how much fat there is. And a more sophisticated test is MRI. But you don't go around doing all these things yourself. You just see your liver doctor.
Like
Liver by getting to your ideal weight and so on.
May I ask a question, please?
Yes, please.
In your talk, you mentioned about the liver being the protector. And how was it not able to protect us from COVID?
So, I don't think anybody knows the answer to why anybody got COVID or didn't get COVID, to be honest. The scientists and the doctors just don't know enough. But yeah, so what happened with what happens with coronavirus infection or the COVID-19 infection is that it attaches itself to something called ACE2 receptors. There is a spike protein part of it. If everybody's seen those spiky things that jet out of the virus.
Yes.
So they attach to a specific receptor on the cell. And actually liver does have ACE2 receptors. But liver kind of catches the coronavirus and detoxifies it. So the liver doesn't suffer much during COVID-19 infection. You will occasionally have liver function tests going up, like SGOT, PT rising, but after 2-3 weeks they fall. So liver doesn't really get much affected.
Okay.
But the coronavirus is inhaled and it locks into the nasopharyngeal space of your body.
Yes.
And then sometimes it goes down into the lungs. And that's all first pass. So it actually hasn't been through the liver at all.
I see.
So that is why the liver is not able to protect you against coronavirus infection. So coronavirus is clever.
So are we still having medicines for cholesterol? Are you still
Yeah, we have medicines for cholesterol. So if somebody has excess cholesterol, especially the LDL type, and or if they have excess triglycerides, which is another form of fat, then there are medicines available to control
medicines
those.
are available, but they are still being prescribed in India.
Absolutely. Yeah, absolutely. Pretty routinely. In fact, when I find a patient with fatty liver in my practice, I would routinely get their lipid profile done. And if the lipid profile is deranged, then I would prescribe the lipid lowering drugs, which is what you're asking about.
Yes. So what I got to know was that the US has taken it off the list and they are no longer giving any medication for
No.
because our own bodies are producing cholesterol also.
So, no, that's not that simple.
Okay.
So what's happening is that it is realized now that not all cholesterol is bad. And there are some medicines that used to lower all kinds of cholesterol, and those are not being prescribed.
Okay.
But the ones that specifically affect the bad cholesterol and the triglycerides are very much being prescribed.
These are statins. You're referring to.
Yeah,
Statins.
are these statins? And
Yes.
another thing is like because statins, one of the side effects of statins is
Muscle loss.
muscle loss and all that, which you said as a part of your talk. So how do you balance that?
So, myostatin is the sister or brother of those statins. If I briefly refer to myostatin.
Yes.
So that's a inhibitor of muscle growth. But taken in the quantities that are prescribed generally. So there are two kinds of patients who have high lipids. One is the mild variety, and the other is who have familial hypercholesterolemia. They have like a cholesterol in thousands. So they will require very high doses of statins.
My triglycerides are over 400.
Yeah, but you need phenofibrate. So you need Rosuva's F or Atolib F. So that's the one that lowers the triglycerides. So if you're taking mild to moderate doses, which is 90% plus of the patients, it doesn't really cause much harm to the muscle. But in excess, yes.
Because I've seen my husband has been taking it, he's a diabetic, and he's been a diabetic for years and years, decades. He has lost a lot of muscle in the lower limbs.
It's entirely possible.
Okay, so I'll ask the final question.
Okay.
A little heart-rending. I recently lost a very dear friend to cirrhosis of liver. So I don't know why he didn't go for a transplant. Let's say the liver is totally destroyed. Could he still have gone for a transplant?
Yeah, transplant is done for people who have lost most of their liver function to cirrhosis.
I see.
In some situations, it's also done for acute liver failure, which is basically a condition that affects people who have been otherwise healthy, and suddenly over a few days the liver fails. So that's only about 5% of the cases. 95% of the time, transplant is done for patients who have cirrhosis.
Yes.
Now, majority of the patients who have advanced cirrhosis will be suitable for a transplant, but in some cases they can't go for a transplant if, for example, they have a liver cancer along with the cirrhosis which has spread outside of the liver.
I see.
So, one doesn't usually know the detailed picture, even among friends and family sometimes. So it is possible that they had liver cancer which had spread outside of the liver, in which case doing a liver transplant is no point. But if the cancer is within the liver and not spread outside, then even then a transplant definitely can be done. The other reason is that their heart or lungs are not strong enough to take a transplant, or they have a accompanying kidney dysfunction. Then again, a liver transplant alone cannot be done, and in these cases sometimes a kidney and a liver both have to be put in. So there are all kinds of reasons why somebody may not be able to undergo a transplant despite having cirrhosis. Of course, the other reasons are not having a donor, suitable donor in the family.
I see.
Because
it has to be the family.
It has to be the family. So there are two kinds of donations, cadaveric donation or deceased donor donation, which is from a person who's dying of brain death or who's died of brain death in an ICU situation, and his or her family members then volunteer to donate the organs of their loved ones. And those organs are given to people on the waiting list. Those are societal resource. They don't belong to anyone. They just, let's say, state owns them and then allocates them to people who are on the waiting list. So that takes a long time because the number of organs donated is not that much. The other kind of organ donation and transplantation is living donor liver transplantation, and the living donor transplantation is where you take half a liver from a living person, and that living person has to be a family member.
I see.
Why is it? Is it something to do with blood matching and all, like they have it in kidney?
So, no, Rishi, it's not about blood matching. All the matching that is needed is blood group matching, that's all. So, if I need a transplant, then I need a donor who's got the same group as mine, or group O, because O is a universal donor. So, group matching is all the matching that is needed. But non-family members cannot donate because donation by law has to be motivated only by love and affection and voluntary nature of the donation. There can't be any financial or emotional coercion. And in unrelated individuals, financial and emotional coercion are very, very common. So there are government appointed committees that approve these transplants, which have nothing to do with the doctors or the hospital management. They are separate committees. Every transplant passes through that. And they would generally not approve non-family members for this reason.
So family could be not necessarily like your immediate, like your child or wife. It could be like a cousin or somebody.
Yeah, it could be.
Because that bond is there. And
exactly. So, you find that sometimes you're closer to your cousin than your real brother, So that can happen. And yes, so first and second degree relatives are allowed to donate. People who are related to you through marriage or through blood relationship, both the types are allowed to donate. So, my wife's sister's husband can donate to me. So that's allowed.
Yeah, that's what I want to do.
Yeah.
So we won't end on this note, rather we'll change the ending. We won't try and reach that stage. So thank you so much, Dr. Soin.
It's been a pleasure. Thank you so much.
Like you said, you kept it in a language which was simple, which we all understood, and he's given us the formula. How we
I'm
don't
sure
do-
most of you knew most of the things, right? The right things to do are very common knowledge, but we tend not to practice them.
Yeah.
Thank
So we
you.
need the motivation for that.
Thank you so much, Dr. Soin. That was indeed a very educative and eye-opening talk, which has opened up new ways of looking at our health. As you have said, the liver is an organ which is ignored by all of us, and yet it is of prime importance. If the liver is unhealthy, the entire body is unhealthy. But if the body is functioning at optimum level, then we can forget about building six-pack abs. We are very grateful that you have given us the knowledge of how to take preemptive measures to avoid pushing ourselves to liver transplant. So that way you're going to get less patients.
Happy with that. I'm going to be contributing in a better way to the health of the society, right?
Absolutely. We are very grateful to Mr. K. and Srivastav, Director of India International Center, for giving us a go-ahead with this program. We'd like to thank IIC's program department and staff for organizing seamless event. Thank you so much to all of you in the audience for taking out time to attend this talk and asking very pertinent questions. We hope that you will all be going back refreshed and raring to follow Dr. Soin's guidelines that all can be fit forever. Thank you. Have a good evening.